There's the bill, there's our district, okay, half the state of Michigan. Everyone said you should keep us informed what's going on. And this massive district, I do. We did a couple telephone town halls, Indian River. About the time the healthcare bill came out in June, we really picked up the pace and traveling around the district getting things done, everything from WNMU, TV, radio, which we did the whole Upper Peninsula. Next day I flew down to Mount Pleasant, all of Lower Peninsula. Press calls, Negaunee Town Hall, we've done them. Look at how I already jumped. Here we are in Ontonagon on January 6th. Tomorrow we're in Houghton. So we're trying to keep on top of this. And again, our next telephone town hall will be in February. It should be the first Wednesday in February, which will probably be a critical time on this healthcare vote. Oversight and investigations. I still sit as chairman of oversight investigation. I'm starting my 4th year of investigations just on the insurance industry. We've been doing them right along, but we've been doing a series of hearings to try to get a handle on what's happening in the health insurance industry. Everything from predatory sales practice and Medicare Advantage to nursing home safeguards. We passed a bill 25 years ago. There was never a hearing on it to see if the bill was even working. Nursing home has changed a lot in the last 25 years. Are consumers protected in long-term care? It's another issue we had. Termination of individuals' health policies by insurance companies. It's called rescissions. That was a hearing we had. We did another one down in Chicago in July 27th. Actually, it was Indiana termination. Insurance company, if you have an individual policy, in their computers they have codes, up to about 1,400 different codes. You go to Walgreens and fill your prescription drug, and when they fill it, the claim is electronically filed. One of those categories come up. If it's something that, let's say, could lead to breast cancer, they'll go back through your application, figure out how can they deny you your benefits. In other words, rescind your contract because there's an erroneous mistake you may have made on your contract. In fact, I've seen them that I put down the wrong weight. The salesperson, the insurance agent says, don't put down your 250 pounds, put down your 180. They put down 180, they found out they were really 250, they terminated their contract. It's called rescission of the contract, therefore they don't have to pay any future medical costs. Insured but not covered, that's underinsured. Example after example of that, if you have a child born like a hemophiliac, like the guy who testified, $50,000 a year he spends just in one procedure for his son. If you have $1 million cap, which a lot of insurance is $500,000 to $1 million, if you're $1 million cap, you're done when you hit $1 million. You have a son that's hemophiliac, you hit it in 3 to 4 years. High cost of small business, that's narrowed small businesses testified in October. All right, the healthcare crisis in Michigan. From 2000 to 2007, premiums went up 78.2%, your wages went up 4.6%. You can't continue. You can't continue that. Your employer can't continue that. The federal government, state government can't continue. The average cost of family health insurance is $13,375. If you went out, try to buy health insurance for your family, husband, wife, 2 children, the average in the nation is $13,375. If our median income before taxes is $38,000, that's about 34% of your income. This year, if you have an individual policy, I'm not picking on them, but if you have Blue Cross Blue Shield individual policy, your policy, especially if you own a business, went up 20 to 40%. Rate of inflation last year was 0. How can you justify a 20 to 40% increase? American Medical Journal.